name is Tess Fall. It is August 22nd, 2022. It is 3 p.m. and I'm going to be performing my head to toe assessment. First, I'm going to be inspecting his skin, assessing his head and neck, face, posterior, anterior, chest, and abdomen, assessing his skin for color, temperature, moisture, texture, edema, bruising, scars, lesions, and nevi. I'm then going to assess his head, noting that it is midline, the symmetry, and size. I'm going to inspect and palpate his scalp, noting his hair color, texture, and distribution, assessing for any lesions, masses, infestations, depressions, or noting any tenderness. I'm then going to inspect his temporal arteries, noting any tenderness. Is this tender?
Nope.
Okay, I'm then going to assess his lymph nodes, assessing his pre-auricular, post-auricular, occipital, submandibular, submental, or tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I'm then going to move on to assessing his TMJ, noting for any tenderness, crepitus, or subluxation. Can you clench, open, and close? Great. I'm going to assess cranial nerve 5, starting with the motor aspect by palpating over the masseter muscle, if you could clench again. Okay, and then assessing the sensory aspect of cranial nerve 5. If you could close your eyes and tell me where you feel this.
Cheek, forehead, chin, nose.
Great, and then I'm going to assess cranial nerve 7, noting for facial symmetry. If you could smile, frown, puff out your cheeks, raise your eyebrows, and do a kissy face. Okay, I'm going to move on to your hearing, or your ears, noting your ear size, shape, and position. I'm going to palpate the pinna and the tragus bilaterally, noting for any tenderness or masses. Is any of that tender?
No.
Okay, I'm then going to inspect the auditory canal, looking for any redness, assessing the tympanic membrane bilaterally. They are intact and pearly gray. I'm then going to assess cranial nerve 8, first by performing the whisper test. If you could occlude one ear and repeat after me.
1, 2, 3.
And the other ear, please.
ABC.
Great. And then I'm going to perform the Weber's test to assess for lateralization. Do you hear this out of both ears or one?
Both.
Okay, and then the Ryan's test. If you could tell me when you don't hear this anymore.
Now.
And then when it stops.
Now.
Okay, and then on this ear.
Now. Now.
Great, air conduction is greater than bone conduction. I'm going to move on to his eyes, looking at his lashes, his brows, his palpebral fissures, assessing his conjunctiva, that they are pink, his sclera, that they are white, looking for any discharge or lesions. I'm going to assess cranial nerve 2, assessing his gross visual acuity by utilizing my Snellen chart. I would be standing 6 feet away, have him cover one eye, and read the line that is lowest that is clear to you.
LTFPH.
And the other eye.
LTFPH.
And then both.
LTFPH.
Okay. I also will assess his peripheral vision. If you could tell me when you see my hand come into sight.
Now. Now.
Okay. I'm then going to assess cranial nerve 3, assessing for direct and consensual pupillary reaction to light. Okay. I'm going to assess for accommodation and convergence. If you could look at my finger and then look at the wall and back at my finger. Okay. I'm going to assess cranial nerves 3, 4, and 6 by checking extraocular movement. If you could follow my finger without moving your head. Okay, and then I'm going to assess the internal structures of your eye, noting red reflex and any abnormalities. Great. I'm going to move on to your nose, noting that it is straight and midline. I'm going to assess cranial nerve 1, your sense of smell. If you could close your eyes and tell me what you smell.
Candle.
Great. I'm going to check nasal patency. If you could occlude one nostril and breathe, and then the other. Great. Nostrils patent bilaterally. I am also going to assess your frontal and maxillary sinuses. Do you feel any tenderness?
Nope.
Great. I'm going to move on to your mouth. I'm going to assess your lips, your teeth, your gums, your buccal mucosa, your tongue, your salivary ducts, your posterior pharynx, grade your tonsils if they're present. If you could open your mouth for me. Great. And stick your tongue out and say ah. Okay. Cranial nerves 9 and 10. I checked his soft palate and tongue row symmetrically with phonation. And cranial nerve 12, if you could stick your tongue out for me. Tongue is midline without fasciculations. I'm going to move on to his neck, palpating that his trachea is midline and straight. I'm then going to assess his thyroid gland, if you could swallow. And again, great. And then I'm going to palpate his carotids bilaterally. And I'm going to auscultate with my bell bilaterally, noting for any worries. Okay. I'm going to have you turn in your seat. I'm assessing his posterior chest, assessing for any signs or symptoms of respiratory distress, such as use of accessory muscles, tripod position, nasal flaring, retractions, cyanosis. I am then going to inspect symmetrical chest expansion. If you could take a deep breath. Great. And then symmetrical tactile firmitus. If you could say 99 each time you feel my hands.
99, 99, 99, 99.
Okay. I'm going to move on to percussion in all of his intercostal spaces. Okay. I'm going to auscultate in all lung fields, starting above his scapula. Okay, I'm going to perform echophony. If you could say E, every time you feel my stethoscope.
E, 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 E.
Great, and then bronchophony. If you could say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Great, and then if you could whisper 1, 2, 3 for whispered pictriloquy.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Great. I am now going to have you turn around in your seat, assessing his posterior chest. I'm inspecting for any obvious deformities, noting symmetry. I'm again going to assess for symmetrical chest expansion. If you can take a deep breath. Great, and then symmetrical tactile firmitus. You can say 99.
99, 99, 99.
Great. I'm going to auscultate. I also also noted for any deformities and symmetry posteriorly as well. Next, I'm going to begin the cardiac exam. I'm going to utilize the diaphragm of my stethoscope first to listen to the aortic, which is the second intercostal space right sternal border, pulmonic, second intercostal space left sternal border, Erbs, third intercostal space left sternal border, tricuspid, fourth intercostal space left sternal border, and mitral, fifth intercostal space midclavicular line, and then the bell over the aortic, pulmonic, Erbs, tricuspid, and mitral. Also at this point, I'm going to auscultate the apical pulse for 1 full minute, noting the rate and rhythm. It is regular in 64. I also at this point would palpate for the PMI. Okay, I'm gonna have you lie down on the couch at a 30 to 45 degree angle to assess for JVD and jugular pulsation. I'm also gonna note any heaves or lifts. You can lie back right here. No, lie down more. Put your head on it. There you go. I would inspect for any heaves or lifts. I also would palpate over the aortic, pulmonic, Erbs, tricuspid, and mitral, assessing for any thrills. I also would perform the cardiac exam while he's laying down, utilizing the diaphragm and bell. So the aortic, pulmonic, Erbs, tricuspid, mitral, and the bell, aortic, pulmonic, Erbs, tricuspid, and mitral. Okay, I'm now going to move on to the abdominal exam. If you could rise your shirt for a little. And I would begin by inspecting for symmetry, contours, noting any deformities. I would begin by auscultating, assessing with the bell of my stethoscope, listening to the aorta, artery, renal, iliac, and femoral. I would then auscultate bowel sounds with the diaphragm of my stethoscope, starting in the right lower, right upper, left upper, and left lower. I would then percuss for any tympany, dullness, or flatness. I would then palpate for any tenderness or masses. Is any of this tender?
No.
Okay, I would inspect for the liver on the right, if you could take a deep breath. Okay, and then the spleen on the left, if you could take another deep breath. Okay. I would then have you sit up. And if you just want to turn your back towards the camera, I'm going to assess for CVA tenderness. Are either of those tender?
No.
Great. I'm going to have you move to the chair. We're going to begin musculoskeletal. I would inspect the joints of your hands, your wrists, your elbows, and your shoulders, noting for any redness, tenderness, swelling, deformities, crepitus, symmetry, and nodules. I'm going to begin with capillary refill on your hands bilaterally, assessing your radial pulses bilaterally. Okay, and then we're going to begin with range of motion of your fingers. If you could flex, extend, hyperextend, abduct, adduct, and thumb opposition. And then if you could do your wrists, we're going to flex, extend, hyperextend. We're going to ulnar deviate, radial deviate, and then rotate. And then of our elbows, we're going to flex, extend, hyperextend. And then I'm going to check the strength of your hands. If you could squeeze, 5 out of 5 strength. And if you could do this, if you could push and then pull. Bicep, tricep strength is 5 out of 5. And if you could pick them back up and then push out and then pull in. And then abduction, adduction, 5 out of 5 strength for his shoulders. If you could shrug against me. Cranial nerve 11 is intact because you can shrug against resistance. And then if you would like to do your shoulder range of motion, we're going to flex, extend, hyperextend behind you. We're going to internally rotate both arms. And then we're going to externally rotate both arms. We're going to adduct. We're going to abduct. And we're going to circumduct. Okay? If you want to sit back down, we're going to begin cerebellar coordination by having you do serial finger opposition, hand flop, and then finger to nose. Okay? I'm going to test for stereognosis. If you could close your eyes and tell me what I place in your hand.
Q-tip.
Okay. And then graphesthesia, I'm going to write something in your hand. If you could close your eyes.
X.
Okay. I'm going to then do light touch sensation. If you could close your eyes and tell me where you feel this.
Arm, upper leg, lower leg.
Okay. I am going to, I'm assessing overall warmth and your skin integrity, noting any edema to your bilateral upper and lower extremities. I'm also going to perform vibratory sensation to your proximal ulnar prominence. If you put your hands out like this, do you feel this?
Yes.
Do you feel this?
Yes.
Great. And then your medial malleolus, do you feel this?
Yes.
And do you feel this?
Yes.
Okay. We are then going to perform deep tendon reflexes. I'm going to assess brachioradialis, bicep, tricep, and then brachioradialis, bicep, and tricep. And then we're going to do patellar, Achilles, and then Babinski. Okay. I'm then going to inspect and palpate the joints of your toes, your ankles, your knees, and your hips, assessing for any redness, tenderness, swelling, crepitus, symmetry, nodules. I am going to begin. Can I take your socks off? I'm going to assess capillary refill bilaterally in your toes. I'm going to assess your dorsalis pedis and posterior tibial pulses. Okay, we're going to do range of motion in your toes. If you could do what my fingers are doing, we're going to flex, extend, hyperextend, abduct, adduct. Great. And then your ankles, if you could plantar flex down, dorsiflex up, inversion, eversion, and rotation. Okay, I'm going to go ahead and check your strength of your ankles. If you could plantar flex down, dorsiflex up. Great, 5 out of 5 strength. And if you can pull towards you and then push away, great. Knee strength is 5 out of 5. And then if you could push out and pull in, hip strength is 5 out of 5. I'll have you stand up we're going to flex for our knees, flex, extend, hyperextend, and then we'll flex, extend, hyperextend. And then our hips, we're going to flex, extend, hyperextend, internally rotate, externally rotate, circumduct. We're going to adduct and abduct. And then our hips, we're going to, or our other hip, we're going to flex, extend, hyperextend. We're going to internally rotate, externally rotate, adduct, abduct, and circumduct. Okay, and then I'm going to have you turn towards the wall. I'm going to have you flex forward. I would assess, I'm going to pull up your shirt, his spine, noting the alignment, scoliosis, looking for any curvatures. Do you feel any tenderness?
Nope.
Okay, so his lumbar spine is flexed forward. I'm going to have him extend up, hyperextend back, laterally flex to the side, laterally flex to the other side, and then rotate. And then let me move forward for me, please, so we can see your neck. So his cervical spine, we're going to flex forward, extend up, hyperextend back, laterally flex to the left and the right, and then rotate. Okay, you can turn around. I'm going to have you walk towards the camera, regular gait, okay, and then walk away from the camera, heel to toe for tandem, okay, and then for Romberg, I'm going to have you close your eyes, or put your arms out in front of you, or, I'm sorry, to your side, and then close your eyes, okay, and then you can open them, and then hop on one foot, and then hop on the other foot. Great, and that concludes our assessment.